Welcome to the South Asian Public Health Association Spotlight Series, a space where we highlight the leadership, impact, and stories shaping the health and well-being of South Asian communities across the United States. We're your hosts, Samira, President of the South Asian Public Health Association.
And Aisha, Vice President of SAPHA. SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the U.S. and the communities in which they live, and has been instrumental in fostering research, advocacy, education, and collaboration to address health disparities and promote equitable health outcomes.
So last season, in honor of SAPHA's 25th anniversary, we had spotlighted the leaders who helped build and shape our organization's foundation. This season, we're expanding our focus. As the U.S. marks a historic milestone with its 250th anniversary, Season 2 celebrates the South Asian pioneers, researchers, clinicians, and advocates whose work has shaped American public health, from groundbreaking studies to community-driven initiatives and equity-focused innovations. This season reflects the wide-ranging impact South Asians have made and continue to make on the nation's health while elevating the needs and lived experiences of our communities.
Today, we are honored to feature Dr. Sunanda Gaur, Professor of Pediatrics at Rutgers Robert Wood Johnson Medical School, Director of the Adult and Pediatric Clinical Research Centers, and Founding Director of the South Asian Total Health Initiative, or SATHI. Dr. Gaur is a nationally recognized infectious disease physician and clinical researcher whose career has spanned two global pandemics, HIV and COVID-19. She has led pediatric HIV programs for decades, overseen more than 40 NIH-sponsored clinical trials, and helped expand Rutgers' clinical research infrastructure, and she has been a leading voice in addressing health disparities through community-engaged research. In 2007, she founded SATHI, one of the nation's earliest initiatives dedicated to improving the health and well-being of South Asian communities through research, education, advocacy, and culturally responsive care.
So Dr. Gaur, welcome to the SAPHA Spotlight Series. We're so excited to have you here. And to start, we wanted to ground listeners in your story and the path that led you to this work. You've dedicated your career to improving health outcomes through both clinical care and research, from the HIV pandemic to COVID-19. And you've done so much throughout the past few years. What first inspired you to pursue medicine and infectious diseases, and how has that journey shaped your approach to community health today?
Good morning. And first of all, I would like to thank you for inviting me to speak to you all. It's an honor. And I'm very honored to be part of this podcast. I have always been very impressed with all the work that SAPHA has been doing over the years. So it's a special honor to do this. So my journey, it's been a long journey, of course. I decided to be a doctor when I was 10 years old. I had role models in my uncle, who was a sort of a country doctor in India, but very well respected. And my grandmother, who was not a doctor, but she was a very strong woman and a women's rights advocate. This is going back in the 60s, right? She was a woman ahead of her time, and she inspired me to do whatever I wanted to do. And then she passed away when I was only about 15, and she died of cancer. And I was inspired to work in cancer research at that time. And so that's what started my journey. And then, of course, I went to med school in India, and then came here in the 80s and trained further, and went into infectious diseases right when the AIDS epidemic was sort of happening in the early 80s. And we saw children coming in with this unknown illness and dying, and no one knew what was going on, and nobody knew whether it was a virus or something else and how it was transmitted. So I was very sort of taken by that illness, and that really inspired me to learn more and more about infectious diseases, and particularly the immune system. I was very impressed or interested in finding out more and learning more about the immune system. So that's how I began, is through that lens of immunology and HIV and the immunodeficiency that went with it. And then, of course, the epidemic just went crazy, right? We had lots and more patients and coming in. And when I look back, I feel like I have learned so much from the HIV epidemic, which I would say my first 20 years as an infectious disease physician was spent immersed in the epidemic. And what did I learn? I learned compassion. Most importantly, because this was an illness that was affecting people that were the most underserved and the most lacking in resources. So I learned that, how society shapes disease, and how to understand that, how to work with them, in teams. I learned teamwork. We worked as teams. I learned respect for all different types of people that were working in this epidemic, the nurses, the social workers, the community health workers. It was team effort to deal with this epidemic that was totally devastating people. So I learned that. At the same time, I learned about the power of clinical research, because here was this epidemic that was a death sentence. And in that span of while I was working with it, new drugs and new drug trials just transformed the disease. So you started and you transformed. And how many people have that privilege to be part of that? And I was just so inspired by how clinical research can really clinical research can really transform a disease. We had children being born with HIV, and then we had trials where we could treat the mom and the baby never got it. I mean, it was mind-boggling. I never thought that could happen, but it happened. So it happened because of research. So I think so that transformed my career completely. And then, of course, came COVID, and I was much more ready by that time, having dealt with one epidemic and understood that there's, of course, the virus and what disease it causes, but it's surrounding it is the society and people and how they perceive things and how information is received by people and how misinformation can really have an impact on a disease and its trajectory. So when it came to vaccines and all of that misinformation, so I worked in that a lot, working with communities to try to explain the truth and separate the myth from the truth. So all of this, my career has been very interesting in that, and doing infectious diseases, I suppose, is at the center of it. And of course, now we are still dealing with COVID in the way of long COVID, which is where my research currently is focused on.
Incredible.
So it's a long answer to your question.
Not at all, not at all. That's been so fascinating to learn more about your career. And you've touched upon how your career has been bookended by two major global pandemics between HIV and COVID-19. And you also shared with us some of the lessons that you've taken away, in these past few years. But thinking more specifically about trust and stigma and community engagement during these public health crises, what are some other lessons you have learned during these times?
Yeah, that's very important. Thank you for that question. So with HIV, the big issue was stigma and lack of trust in the medical system. And people, it was so ingrained, the attitude medical professionals even had towards people with HIV. There was judgmental blaming the patient for the disease they have. Unfortunately, that was all going on. And I learned a lot. I learned that what happens to a person is a product of where they're coming from. It's not always in their control fully. And that as medical clinicians, we need to be compassionate to understand the milieu, the environment that shapes a person rather than laying blame on the person, to understand from the bottom where they're coming from, to engage with them and learn from them and meet them where they're at, for them to trust us and to, if we want to make a change, we need to start there, because we need to respect, we need to understand their environment, their culture, where they're coming from, and then we can make a difference. We cannot be working from the top and hoping that, and that was true with HIV, but it's true with everything. It's at the bottom of any disease, any community you look at. It's true with COVID and the misinformation. It's true with research, where people don't participate always in research from communities that are underrepresented and under-resourced historically. They don't want to be participating in research for many reasons, and one of the main ones is lack of trust in institutions. And we are to blame because we have not engaged enough. We have not, as in big universities, big institutions, we are all caught up in our own trajectories, have forgotten that the community that we are trying to benefit, we have never engaged. We have not engaged enough. We need to be embedded. We need to figure out how to do it. And one of the things is, I'm a faculty member, of course, at Rutgers, and we have young faculty and senior faculty, and that when you're in an institution, you're worrying about your promotions and your CVs and how you're building it, and all of that is important. But what we as institution need to recognize is that we really need to make a change. We need to figure out how we are going to evaluate faculty, not only based on how many papers they published, but on what they did for the community, how they've engaged, what is their work. There needs to be value added, and there's not enough of that. And I'm sorry, I'm on my soapbox with this, but I feel that this is such an important thing to really make a difference in. You can take any disease, you have to do that commute. And so I have learned that through my career, but it shouldn't take this long to realize that. I think young people, already I see a difference. I think the new faculty are much more aware of the effect of culture and environment on disease and people. So I think that hopefully it'll change. But that was my lesson, is to really understand and engage with the community you're going to serve.
Yeah, that's really insightful. And I think it leads into, this next part that we're going to be talking about, where every transformative initiative has an origin story, a moment where the need becomes impossible to ignore. And you've talked a lot about, just the areas where we needed to improve. And so in 2007, you founded the South Asian Total Health Initiative, or SATHI, long before South Asian health even became a widely recognized, area of study. And right now we have so many people who are invested in this, but before there wasn't. And so what gap did you see at the time, and what motivated you to create SATHI?
Yes, so thank you. Sathi's story. It goes back to 2005, actually. I don't know if people realize, or if you know, that the first conference on South Asian health in the country was held at Rutgers.
Oh, wow.
And I was an attendee at that conference. And actually, I had a couple of posters. One was about HIV, because I was doing HIV work then.
Yeah.
HIV in South Asian women that we had been seeing in our work. And I attended that conference, it's a whole day conference, and several speakers talk. And I also gave a talk on TB, tuberculosis in South Asian. So I listened to these lectures about the disparities in cardiovascular health and other diabetes, mental health, and this another person that was attending that conference was Dr. Naveen Malhotra. So we didn't really know each other at that time, but at that conference, we were both so inspired, and we talked. And I had always wanted to do something for the community. I'll backtrack a little bit. I was doing global health at that time because of HIV, and I was going to South Africa and India, engaged in HIV treatment education and starting programs in those countries. And then, so I was interested in global health. And then I found that I was not able to travel as much because of family issues. I was raising a family at the same time. So then someone said to me, you know what? Local is global. And I said, that is wonderful. There is a South Asian community right here in New Jersey, and a growing community, and with all these disparities. So it just felt like the right moment. So over the next several months to a couple of years, we started to talk more, got more people engaged from the community who were interested in this, in doing something about South Asian health. So it was really a grassroots effort, and eventually it evolved into becoming SATHI, which found a home. We started out thinking it'll be a nonprofit, but then it found a home at Rutgers, and it became a Rutgers program. So that's how we started, and really it was to address all these health-related gaps that were there in the, we found that there was not much data, there was not much research happening, not many people paying attention to this, not much funding going towards this. So all of that really, inspired us to do something and try to get funding and get something going in this field.
It's incredible to think about how the landscape has shifted so quickly, but I can imagine that the progress might have felt very slow in the beginning. What did you feel as you began SATHI and began making outreach and reaching out to different organizations? What did you feel were the biggest gaps, and what took the longest to get people's attention on what mattered the most about South Asian health?
Okay. So first thing we did was sort of put out our concepts, right? So one was, it was a three-pronged initiative. First was research, both community-based and other types of research. Second was education, both of community as well as professional. And the third was outreach to the community. So these three prongs is what we settled on. And the first thing we did was a survey of the community needs. And what we found, of course, we were not surprised by it, but people were not accessing healthcare, dental health, cancer screenings, just even going for regular checkups was not commonly being done in the community. Among professionals, we realized that there was no understanding of the risks that South Asians faced because of the model minority myth. The fact that cardiovascular disease occurs 10 years earlier is 2 to 3 times more prevalent, that diabetes were 2 times more prevalent and occurred earlier, that cancer risks were higher, and the uptake of preventive care was so low. People in practicing physicians didn't know that. There was no understanding of that. So we set out to do conferences, and we held, we did conferences, we did other types of professional education, we did community, we started to develop small community programs, one at a time. It was very driven by what funding we could get, because of course everything needs funding. So that was a big gap, funding gap, in addition to the other gaps. So yeah, that was our initial focus. Excuse me.
It's great to hear, because there's a lot of overlap, with the work that SATHI's been doing for so many years, and also the interests of SAPHA. And so one of SATHI's core goals is addressing health disparities and promoting culturally competent care. What does culturally responsive healthcare for South Asian communities look like in practice? And what can healthcare systems do better to meet the needs of our communities?
So, I think cultural competence or cultural appropriate care has so many terms now, right?
Yeah.
It needs to begin with cultural humility. I think that no one can know every culture, right? We cannot. It comes back to, again, learning from your patients, learning from the community first, and being respectful and being humble about what you don't know, and ask the patients what you don't know, what they want. And that's really the main message of culturally competent or culturally appropriate care. It's across any community. And that's what, we are trying to impart for our medical students, is that, it's that humility that's necessary. And you have to ask, you cannot assume, you need to ask, and ask with humility, and to develop trust. So it's no different in South Asian communities. So we did several projects related to developing culturally. One of our biggest one was the stroke. We developed a stroke curriculum, which was funded by the New Jersey Department of Health. We developed a curriculum for stroke prevention for South Asian communities. And excuse me for a minute, I just need to take. And we said, so we developed a curriculum. It took into account cultural beliefs and religious beliefs, language, all of those things in that curriculum. And we administered that to, I think, about 500-600 people over a period of 3 years or so. And that was published. So that was one of our biggest projects, developing a culturally appropriate curriculum. We did another one with the diabetes curriculum for diabetes prevention, which we did with the help of a temple, in which we were working with that temple to develop. So we got feedback from the temple congregation about it was a CDC curriculum, and we adapted it to South Asian. In this case, it was really Asian Indian because of the temple that we were working with. But I think all of this work is very painstaking, slow work to be able to develop, and it requires a lot of community engagement to do it.
Mm-hmm. Seen that as such a theme with SAPHA as well, that and whenever we're able to engage the community to put out resources or develop resources, the impact goes so much further, and the resources are also getting used in greater amounts as well. So that's terrific to hear some of the examples that SAPHI and that you have created over the last 2 years. Is there a particular program or partnership or even a research initiative that comes to mind as maybe one of the most memorable for you or one of your favorite ones that you found made the greatest impact to the community?
Okay, I think the SAHA's curriculum, which was the stroke curriculum, was, I think, very impactful. One of the things we did with that was train peer educators. So because we were just getting the message out of acting fast and recognizing stroke, and that you need a get to a hospital within a certain time frame. And I feel like that one was the most impactful because not only did we train the people we trained, it went further because of the peer educators that went out and did that carried the message forward. So that was good. The other work that I really, which is currently still one of our current projects, is I'm working with, so Rutgers has a Center for Asian Health that is funded by NIH for the last 5 years. And SATHI has been working with them in basically the idea is to develop more research in South Asians and to develop new investigators who, who are interested in advancing the field and to get more projects. It's one of the problems, as you know, is there are not so many people focused on working on South Asian health research. And it also has to do with funding and what NIH priorities are and other priorities are. But this center the focus is on Asian health, including South Asian. So we've been able to get more research done in South Asian in different fields. In this particular situation, it's with Alzheimer's and with dementia and aging, as well as stroke and cardiovascular health. There's so many projects happening in South Asian health because of that. And that has been very rewarding because, just to see more people engaged in this field.
Mhm. Yeah, that's really important for people to know, that this is something that's available at Rutgers as people are exploring their future careers in South Asian health. And so just pivoting a little bit to, the general South Asian population, South Asians face disproportionately high rates of chronic diseases, as you know, such as diabetes and cardiovascular disease, as well as growing concerns around mental health and access to care. What health concerns are you most focused on today, whether it's through your own practice or as part of SATHI? And you touched upon this with the aging aspect, but where do you see the greatest opportunities for improving health outcomes are in South Asian communities?
Wow, that's so many still. There's so much still needs to be done. First, of course, the data disaggregation, which has been a problem because, as you know, the data is not collected in a disaggregated ways. So that really needs to change. And we don't have any particular initiative right now, but hopefully in the future, something in that. Currently, what we are doing mostly is still working on stroke. We're working now on post-stroke survivors and their experiences in mental health access and culturally appropriate care for that post-stroke population. That's a current project. We are very interested in youth mental health. We've done one project and we are looking to apply to do some more work in that area, which is not another area that has not received a lot of attention. We did a project couple years ago and it's finally getting published. And what we found was, of course, there are challenges. One of the things I thought was interesting was even though we know that youth are challenged living between two cultures and the conflicts, but there was also a resilience factor, which is the most of the youth related. This was a focus group project. Felt very proud of the culture where they come from, and that piece of pride becomes a resilient piece, part of resilience. So we want to study that some more. So that's one. And then we are talking about end of life care. And we find that many times that South Asians, when they come to the hospital or the emergency room, they have not thought about those questions and how to deal with it. And they often don't have an advance directive and things like that. So that's an area that some of the faculty, what we do in SATHI, is very driven by who the faculty are and what their interest is and where the funding is. So, because there's so many, any place we look, there's work that needs to be done. Another thing I didn't mention is women's health and women's cardiovascular health when it comes to South Asians. That's another area of focus that gestational diabetes, those are things that also need to be done.
These are such important topics, and there's so much overlap between them, but they certainly deserve the individual attention and care. And it's so exciting to hear SAPHI focusing on these topics and to make space and encourage others to also join these adventure initiatives and be able to see what is possible to learn more in this field. Throughout your career, you have built so many different programs and led major research initiatives and also mentored countless trainees and emerging leaders. What advice would you give to the next generation of South Asian public health professionals, researchers, clinicians, and advocates seeking to make an impact?
Great question. As I look back at my career, one of the joys of SATHI particularly has been the groundswell of interest in SATHI that has occurred from the beginning among faculty, junior faculty, and students. It's really medical students, Rutgers students. There is such an interest in doing something for the community this has been my greatest pleasure to be able to guide people who have an interest into doing something, whether it be going to health fairs and doing community work, or it's developing a research project and seeing it through, working in the community, eventually maybe getting a publication, and then some have actually, as faculty, taken that on as their area of research. And that is the most rewarding if we can see that happen. So, I've loved working with students, and that's one of the things I'll miss. I am retiring this year. And I think if I look back, I'm retiring from Rutgers, but I'm not retiring from doing the work in the community, which is very near and dear to me. And I don't think I'll ever retire from that. But I will, the students I will miss in terms of Rutgers. I think that opportunity is such a gift. And I just love that my students, I love the energy they bring. I love to be able to help them reach whatever their goal is. So that has been a real pleasure and a real joy and a real gift to be able to do.
Well, congratulations on your retirement. I'm sure you have so many plans for the future afterwards. But as we look ahead, your perspective has been so great and is continuing to be invaluable for us. As you reflect on your career and the growth of SATHI, and as your retirement is coming close, what gives you hope about the future of South Asian health, and what would success look like 10 years from now?
Well, I am very hopeful because, as I said to you earlier, the level, if I say, I won't be overstating if I say that on a weekly level, I get 3 to 4 or 5 emails from people that are interested in doing something in South Asian health. And that shows you there is interest. We need to harness it, and put it to the right channels. So that's the first barrier, right? That are there people out there that want to do this work? And I think there are lots of people there because, as a community, we have lots of doctors and we have lots of people interested in healthcare. So we have the people that are interested. I think we need leadership. And for SATHI, it's going to continue. It's not stopping because I leave. Hopefully I'll introduce you one day to Dr. Nandini Murthy and Dr. Navina Yanamala are taking over as leaders of SATHI. And I'm hopeful that the work will continue. The challenges are getting funding. That still remains a challenge, but I think we have been able to get funding in SATHI, small amounts, but enough to be able to do some work in a particular area. Hopefully we'll have researchers, and we have some now, that will be able to focus and apply for greater grants and more NIH funding. My hope is that in the next decade, the data disaggregation project would come to more of a fruition, and we'll really have better data and more research in the area. I think those are my hopes and desires, and for SATHI and South Asian health as we move forward. As I said, I am continuing to be engaged even after retirement in some form and another, and probably be able to work more in this area, which I'm looking forward to.
Certainly. And we're excited to do that alongside with you. I think what you were sharing about the hope and the collective excitement and call for additional funding within the space to South Asian health and seeing how that can increase over the next decade is something that we aspire to support as well. And it's encouraging to hear that from you. Given the evolving public health landscape and the challenges facing our communities, we'd love to close with a forward-looking question. And you began touching on this a little bit in your comments about data disaggregation, but if you could influence one specific policy, research priority, or systems level change that would significantly improve South Asian health over the next decade, what would that be and why?
So data is one. I think that if we start collecting at all systems, and we were able to do this in our EPIC system here, that they do now collect in our hospital system. They collect data segregated by different Asian subgroups, including Asian Indian. But that needs to happen across the board. That is very, very important. Second, of course, is more funding, to do some of this work. I think right now, the environment, of course, is difficult for any research, let alone minority health research. But hopefully that will change. And I think over a course of several years, hopefully my hope is that we keep shining the light on this problem, that there's not enough research, and between your work and other folks, that we shouldn't let up, and we should keep this in the forefront of the policymakers and people who are in charge of funding to keep pushing. We have to. If we don't, then who, right? We have to do it. And it behooves us to keep this in the forefront.
I like that so much. Just keeping that light on and keeping the spotlight on and tension on this topic is is certainly pivotal, and thank you for that. Thank you for sharing that. And thank you, Dr. Go, for sharing your overall journey and your insights and the remarkable impact of your work. Through your leadership in infectious disease, clinical research, and community engagement, you have truly helped advance our understanding of health equity and build critical infrastructure to improve the health and well-being of South Asian communities across the country. Through SATHI, you've helped lay the foundation for a growing movement dedicated to addressing South Asian health disparities and empowering communities through research, education, and advocacy. Thank you.
Thank you, Dr.
Thank you.
We're just so
Thank you.
excited to have you with us, and I hope our listeners learn a lot from your comments. And to our listeners, we hope today's conversation inspires you to learn more about the health challenges and strengths within our communities, and to consider the role each of us can play in advancing health equity. Whether you're a researcher, clinician, student, advocate, or community member, meaningful change begins with awareness, engagement, and action, as Dr. Gaur has mentioned. You can learn more about SATHI on the Rutgers website, and we'll drop it in the comments as we post this. And to explore resources and learn more about SAPHA's work to advance South Asian health, you can check out our website at www.sapha.org. Thank you for joining us for this episode of the SAPHA Spotlight Series. Follow us on YouTube and Spotify to stay updated on upcoming conversations throughout the rest of the season. Until next time, this is Samira and Aisha signing off. Thanks.